If you're just joining us, this is ATN Health Forum. We'll make a compilation on critical health issues designed to reach all segments of the society and prefer solutions through the instrumentality of medical professionals. And we have with us today Dr. Ebere Onyiji. Breast cancer is a type of cancer that develops in the breast tissue, abnormal cell growth in the breast that can invade surrounding tissue and spread to other parts of the body. But then, I'm not the doctor. So welcome, Dr. Ebere.
Thank you for having me.
It's good to have you
I
here.
wanted you to continue the way you were
I just realized I am not the doctor. Well, that's why I have you here, and I'm going to take advantage of it.
I'm all yours. Thank you for having me.
Okay, so this week is World Breastfeeding Day. To that effect, I really want us to talk about breast cancer.
Okay.
So the first question is, what is breast cancer and how does it develop?
Okay, so like I explained earlier from the right up, I saw you read it. So breast cancer, every cancer is when there's an abnormal cell growth that is growing beyond the borders, beyond the confined tissue space.
Okay.
So when it happens in the breast, we say it's breast cancer. So the cancer that occurs in the breast, where a part of the breast tissue will start overgrowing and then start causing problems. That's basically breast cancer. There are many types of breast cancer, but it doesn't help us in this show if I start.
Because you might not really understand all about.
Yes. So that's about breast cancer. And what causes breast cancer? Like most cancers, we don't know. We can't say for certain this is the cause of a cancer, but we can say these are risk factors. These are things that we have found that when you see A, B, C, D, E, there's high chances of seeing D. So we say these are risk factors. And okay, so there's no definite cause of breast cancer, but there are things we have seen that when they are present, they increase the chances of someone coming down with breast cancer.
Okay, so we now know that breast cancer is abnormal growth in the breast tissue. That's what some of us call breast lumps, yeah?
Okay.
Is it every lump that's cancerous?
No, not at all.
Okay, so sometimes when we see lump on the breast, we should not be afraid that we have cancer.
That's why we're there.
Okay, so my next question will be, how do they affect treatment options? I was going to talk about this breast cancer, different types of breast cancer, but then let's first look at the symptoms of breast cancer.
Okay, so it's very important we mention about the symptoms of breast cancer because unlike when you have a road traffic accident, for instance, you have pain on the leg, you have bleeding, you now know there's an issue. Okay. Breast cancer is something that can happen and there is no symptoms as it were. So that's why we say examine the breast. Normally, before a breast cancer will come, we notice common changes. I'll start listing them out. Okay. We first of all see a lump, or as it were, a mass in the breast. Okay. And it's important to know that this mass is a painless mass. So it can lie there quietly and you will not know it's there. Oh. So the mass is there anywhere in the breast or around the breast tissues, even in the armpit. It's important I mention that in the armpit. Okay? Then you can also have pain on the breast, like pains around the breast tissue. Then you can have changes on the skin, the things your eye can see. First of all, you can see some rashes on the breast, you can see some redness, you can see swelling, you can see an abnormal deviation of shape. When you compare the two breasts, this other one is getting disfigured. Now we can also do skin changes, we call orange, where the skin will look like back of an orange. You see that dot sign you see on the oranges. You see it on the breast as if it's having goosebumps, but it's there permanently. Now another important sign you may see is discharge from the nipple. Okay. Sometimes people notice from their breast they are discharging pus, they are discharging blood. It's not something to sit down and wait. Those are the symptoms you see, and we are afraid that this might likely be a breast cancer. Okay.
But in other words, sometimes when you see the symptoms, it's not a guarantee that it's breast cancer. It can be.
Most often than not, it is.
Okay, so you really need to observe. If there are any changes in your breast, please see a doctor. Immediately. So early warning signs. I used to think that, or some of us we have this notion that what's it called, discharge on the breast can also be hormonal imbalance.
Yes. It's not in your place.
I respect my place.
Why we want you to come is that we don't want you to sit at home and say, okay, no, this discharge in my breast is, oh, I know what you're about to say.
Self-medication.
Oh, yeah. So we don't want you to do that. And then when you come to the hospital, we say it was not. We want you to come when they do an appropriate test. The doctor can now say for certain that this is not it, it is this one. So when it comes to the breast, anything you see on the breast, please don't delay. Rush down to the nearest hospital.
Please don't assume you know it. Don't assume it's rash. It's what's it called, discoloration from the cream I'm using. It's a reaction from this. Whenever you notice any change within the breast region and the armpits, like she said, please see a doctor. Okay, the next question will be, how does this breast cancer thing happen? You won't just sit and develop breast cancer, or are there factors that give birth to breast cancer?
Okay, yeah, so what you're asking me is, why would there be 3 women and 1 person has a breast cancer?
My point exactly.
Okay, so now, first of all, what I'm going to call are risk factors. It means that they predispose you to having the breast cancer. It doesn't mean that if you have these risk factors, you are going to have breast cancer. Okay, so it's not when I call something and you freak out and you say, oh, Dr. Berry said if you have this, you are going to have breast cancer. No, we're saying that with multiple of these risk factors, there's higher chances of having a breast cancer. First of all, now high on our suspicion is when there's a genetic predisposition, when there's a first family history of breast cancer. What do I mean? Your mom, your sister, or your child had a breast cancer. Okay, that's family history, direct family history of cancer, any form of cancer, by the way, died of a cancer. Then you are watching out for yourself. If you're a woman, especially of breast cancer. Then what are other factors that are specific to women? First of all, having a breast is what makes you have a breast cancer. So being a woman is a problem. Okay? Yeah. So being a woman, men have breast cancers, but it's quite common in women. Okay. So yeah, but so being overweight, when you are overweight, obesity increases the chance of breast cancer. Okay. When you are smoking, it increases the chances of a breast cancer. Now, it's important I mention that women who don't breastfeed their children are at higher risk of having a breast cancer. Really? Yes. So when you give birth and you say, oh, I don't want to breastfeed, I don't want my breast to fall. How is breastfeeding supposed to prevent? Sorry, we'll go back to the risk factors, but how is breastfeeding supposed to stop or prevent? Breastfeeding have been known scientifically to, first of all, cause the breast to, in quote, be exercised. Okay. But then lactating and then breastfeeding is known by scientific proof to reduce the chances of having breast cancer. So they know that women who never breastfed have higher risk of having breast cancer. So if you have a child, you breastfeed. Okay. So can we go ahead, or you like the breast part? So for those who don't have children, what do? They are naturally exposed to breast cancer. Oh yeah, being nulliparous is high risk for breast cancer. Means you've not being what? Nulliparous means you don't have children. Yes, that's what it means. You don't have breast cancer. Don't mind if she's being naughty. Okay, so for risk factors, we also know that women who take family planning beyond the age of 35, especially hormonal therapies, when you have gotten to menopause and all the signs of menopause have started coming in and you cannot endure, you want to take estrogen to make you, to reduce the symptoms you see with menopause. That thing you're taking increases the chances of a breast cancer. Okay? So it's like neither here nor there for women. And so it's either you just go ahead giving birth non-stop. Oh, no, not non-stop, but at least give birth, breastfeed. Okay? Then when you are going through menopause, be patient with your body to go through it naturally. Except the symptom is so severe that a doctor will weigh the risk against the benefit and then put you on a menopausal management, like in terms of hormone therapy. Okay? So those are the chances. Smoking increases the risk of breast cancer, just like every other thing. Alcohol increases the risk of breast cancer. Alcohol. Okay. So all right, I didn't know that. But it's also important to mention that being black, breast cancer is commoner in black women. It's in fact it's commoner in everywhere, but black women, yeah. So I've mentioned that being a woman is a risk factor. Having a breast is the main problem. Okay. And being black. Then smoking, alcohol, obesity, first degree relative with breast cancer, and then hormone therapies when you take them. And then all sorts of other lifestyles that are not healthy just increases the chances of having a breast cancer. Sorry, I'm going to talk about the black part because I'm black now. No, all of us are black. Let's not talk about the black part. Okay, let's leave the black part. Okay, so those are the risk factors, and we watch out and say, okay, reduce these risk factors and then watch out. But For breast cancer, we're going to be very, very emphatic. The solution most times to breast cancer is early detection. When we get to that point, I think we will get to that point, right?
Early detection. This breast cancer thing is really scary for women.
Oh, yes.
You know, but then you said even men have breast cancer.
Yes, and the mortality is higher in men when they come down with it. If a man will ever get breast cancer, the chances of survival is slimmer than for a woman.
So now for the men, the symptoms for women, is it the same as the men?
Yes.
You know, most of us have this notion that breast cancer is just for women.
No, it happens in men. It is common in women.
So if you're a man out there, this is also for you. Don't think that, oh, I don't have big breasts, I have chest, so it's okay, I don't have breast cancer. You just heard the doctor, she said even for a man. So what the symptoms of mentioned, whatever discoloration, anything you see on your breast, rashes, swelling, lump around the breast region or the armpits, please see a doctor. Don't assume that you know what it is. Don't pretend that it will go away. See a doctor and get help. Like she rightly said, the major way, the easiest way to get out of it is early detection. That's when they know if there's anything that can be done. But then when it's detected early, what can be done?
Treatment. Okay, I want to be very, very, very patient and say this one.
Okay.
If a breast cancer is detected early, it is curable. Okay, what has killed a lot of our people is that you see these symptoms, in fact, is that you don't see it, you don't check, or you check and you see it and you just ignore it and say, oh, I'm in Nigeria, I've been praying, wherever I came from, it will go from there, and then you just ignore it. But if a breast symptom, you see it and you come to the hospital, is tested, and it's proven to be cancerous, treatment can give you 100% chances of cure.
Without losing the breast?
With even losing the breast. What are you doing with the breast, by the way? Yeah. So you have to be alive to have a breast. This is very important. This is a social problem we've been battling with. People ask me, oh, doctor, am I going to lose my breast? If you die, the breast will go with you to the grave.
True.
So it's better if a doctor advises you to have a mastectomy, that means removing the breast. You remove the breast and have only one breast. There are so many artificial breast materials you can use that will give you the same physical look like a normal breast. But you'll be alive while at it. Okay?
Okay, so early detection can guarantee
A cure.
A cure.
But anything after them, breast cancer is a social problem. It's affecting a lot of women. It's killing people every day. Because when it's not found early, what the treatment can do is just to prolong time.
Okay, so let's move on. The question is, what are the treatment options for breast cancer and how do I choose? When someone comes down with breast cancer, what are the options you have and how do you choose which is best for you?
Okay, so first of all, we'll start with investigation. If you have a suspicion of a breast cancer, you come to the hospital, your doctor sees you, makes you have a test, a mammogram, do all the necessary investigation, and then take out the materials, check it, and they say, oh, this is cancerous. They will put you through 3 lines of treatment that we have. One, we have the chemotherapy where we use drugs. We have radiotherapy, and then we have surgery. Surgery means total excision, mastectomy, and removing the breast in its entity. The treatment for breast cancer is not individual specific per se. You don't get to choose, I don't like this, I like it. The doctor will tell you what's best for you considering the stage you came for treatment. Okay? So there's a standardized method of treating breast cancer. That when you come, depending on the stage you come, your doctor will advise you on what is best as at the time that you presented to the hospital. So, but the treatment for breast cancer is these 3 basic treatments. We do chemotherapy, we do radiotherapy, and then there's a surgical treatment for breast cancer, yes.
So that's to say, because I know someone has asked me, is the only cure for breast cancer surgery? So you've already answered that question. It's not surgery.
That's not the only cure.
So surgery is more like the extreme, if it has gotten to the extreme where we have to remove the breast totally.
No, but surgery is the opposite, ironically. When the problem has advanced, surgery may necessarily not help.
Okay, I'm trying to understand that. So early detection, if it's been detected early, maybe a lump or something and it's cancerous, we might just have to remove the breast so it doesn't spread.
Yes. If you have an understanding, after watching this show, I want you to know that having a breast is not as important as being alive.
Okay.
So I used to tease my patient and I tell them it's only when they see a breast that the cancer can eat it. So if there is no breast, there will be no cancer, like naturally to go with it. So a doctor can offer you surgery at the early stage of breast cancer treatment if they think that, oh, this thing have not gone beyond this confined space. If I do a mastectomy, I can arrest this cancer progression. Because the problem with breast cancer is not in the breast. The problem is that it's going to extend beyond the breast into the neighboring tissues, go to the lungs, go to the brain, go to the bones. That's called metastasis. And that's when a lot of people will come, when it's beyond the breast now. The chemotherapy is going to attack the cancer cells wherever they are found, but having a mastectomy at this point may not give you a cure because you presented late.
We're still talking about the surgery part, because I'm sure some persons are wondering if there's a way to avoid it. When it's been detected early and we have to remove, can we just remove the lump?
You can remove the lump. Yes, that's what I'm telling you, that it depends on the presentation.
Okay.
That's why we say go early.
Okay.
The earlier you go, the less invasive your treatment will be. Okay? The earlier somebody presents, the less invasive their treatment will become. So go early to have the least, cheapest, and best treatment option.
The radiotherapy and chemotherapy, what are they supposed to do?
Kill the cancer cells.
So with that, with the therapy session, is it possible? Can you guarantee a cure?
It depends on the level, like I've said earlier. We don't want you sitting at home and say, oh, well, anytime I like, I go for chemotherapy to cure. No. We said early detection means once you notice any symptom at all, as it is, as it were, no matter the symptom, present early. Okay. Treatment outcome is best with early presentation. That's just the summary. Okay? When we discuss treatment option, we don't want to scare the patient. We don't want you to be afraid. We want you to come. When you come and sit with your doctor, with respect to your presentation, the type of cancer, and the time you presented, that's the degree of the problem, they offer you treatment options that are available to you.